It's time for another NCLEX review. So this is number 4 in this series. Be sure to check them all out. And the question is, which is the best for a client in post-operative care for eye surgery? So we've got 4 options here. Now, when we're thinking about these 4 options, I want you to remember is to keep their intraocular pressure low. And what this basically means is inside of the eye itself, you don't want much pressure here. So as we're looking through these options, let's think which would be the best for that. Letter A, watching a circus. First off, I don't know who goes to a circus right after eye surgery, but this probably wouldn't be the best idea because when you're watching a circus, you're going to have to be moving your eye a lot. That draws some blood flow to the eye, and that could increase the intraocular pressure by diffusion through those capillaries. So we don't want that option. Bending over, you can probably predict if you bend over, gravity will pull some of that blood towards your head, potentially your eye, increasing the pressure. So you don't want that either. Lifting objects, once again, after any surgery, you don't usually want to lift too much because that increases your blood pressure and that increases the risk that any sort of cuts or tears you have in your blood vessels could burst because of the higher pressure. So obviously, the correct answer would be D, watching TV. Now you're still using your eyes here, but this is a really soft way to use your eyes and it's fixed on a point rather than moving a bunch of different directions. So that's why watching TV at one point in your center of view is actually a really good thing after eye surgery. On to number 2. We've got the question, which is a likely symptom for a patient with mitral regurgitation? What a wonderful word. So I'm going to let you look at the answers here and I want you to think about which one is correct. We've got altered levels of consciousness, dyspnea, say that 5 times fast, dyspnea, 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 dyspnea upon exertion, increased Cpk concentrations, or chest pain. So as we think through this question, we need to know first off, what is mitral, right? And the mitral valve refers to the valve between the left atria and the left ventricle of the heart. So I diagram the heart over here, and we need to be looking on this left side of the heart right here. So here's your mitral valve. And the goal of any valve is to prevent backflow, right? Blood is moving in a one-way direction through this left side of the heart, so we don't want it to go backwards. But in this case, they're having regurgitation, which basically means blood's flowing in the opposite direction we want it to. So instead of going to the body properly, what will happen is the blood is going to pool up, and pool up backwards because it's not getting pushed out properly. So therefore, we're going to have some blood that's going to be kind of just sitting in the lungs, causing what's called pulmonary edema, which is basically fluid accumulation in the lungs. So now that you know that, think about which answer is probably right. So let's go through them quick. A, altered levels of consciousness. This likely is not going to be correct because this has to do more with the brain state in general. Now, you could argue that since we're not pumping as efficiently to the body, including the brain, the head region, right? If that's not getting enough blood, that could go with different levels of consciousness, but that's in an extreme case. And this isn't as extreme as, say, like a heart attack, right? Whereas B, so dyspnea, you need to know that dyspnea is labored breathing or difficulty breathing, and especially upon exertion. So basically when this person starts walking or trying to jog, it's really hard to catch their breath, right? This would be the correct answer. And that's because if you have fluid accumulation in your lungs, you're likely not going to be able to inflate them properly and get as much oxygen as you need to the lungs. If you're not getting enough oxygen, you're not going to feel very good upon exertion because your cells need the oxygen to make energy. So now that we know it's B, let's go through the last 2 just to be safe. Increased Cpk concentration. This stands for creatine phosphokinase, and usually this increases in your blood when there's some sort of muscle damage. If you have like a heart attack, a lot of the time Cpk and troponin levels will be pretty high in your bloodstream. In this case, there's no real damage to the muscle itself, so that would not be correct. And lastly, chest pain. Now, you could argue there's going to be some blood that's going to be pooling in the heart. Perhaps that could cause a little pressure, a little bit of pain, but it wouldn't cause the type of chest pain like a heart attack would, right? Where the actual muscle of the heart is being damaged due to lack of blood flow. So there we have it. B is the correct answer. All right, guys, last one here before you check out the other videos in the series right here. Which is the greatest risk factor for PVD or atherosclerosis? So before we get started, PVD, remember that stands for peripheral vascular disease, basically just talking about any disease corresponding with any blood vessels throughout your body, or atherosclerosis, which is the hardening of the vessels, specifically the arteries is when we're talking about that. So which is the greatest risk factor? We've got low LDL, high HDL, low triglycerides, or high LDL. First off, we need to know what the heck these stand for, right? LDL stands for low density lipoprotein. And remember, this is how you actually carry cholesterol in your bloodstream. And you want to remember that LDL should be low. All right, so if you are a nurse, you want these levels to be low, which is nice because they both start with the letter L, right? However, HDL levels you actually want to be high. That is a good thing. So remember H and H and L and L. HDL stands for high density lipoprotein. This is usually when you have more proteins per cholesterol molecule in the sort of capsule floating through the blood, and it doesn't cause many issues, whereas LDL could cause issues. So the first 2 would be incorrect. Low triglycerides. Triglycerides is a fancy big word on how your body actually stores and packages fats. And in this case, if they are low, that's actually a good thing, because sometimes both triglycerides as well as LDL can cause those arteries and blood vessels to accumulate plaques and fats inside of them, thus closing up the diameter of those vessels, thus causing all sorts of issues. You don't want your vessels to be narrowed, okay? So therefore, the correct answer would be D, high LDL levels, because once again, if it leads to the clogging of those vessels, you'll likely have some sort of peripheral vascular disease or hardening of the vessels themselves. If this was helpful, be sure to like this video and check out the others in this series here.